problem that existed before the pandemic maxed out our healthcare system was the lack of family physicians in every province. Well, there is a solution to that, according to our next guest, but it is going to require doctors and governments getting on board. Tammy O'Rourke is a nurse practitioner and assistant professor at Athabasca University, and she joins us this morning. Welcome.
Good morning, Anne-Marie. Thanks for having me. I always like to talk about nurse practitioners.
Absolutely. You've set up 2 nurse practitioner-led clinics, one in Alberta, one in Ontario, and you say if we had more of these, it would wipe out those wait lists, that need for family physicians, the backlog anyway. People who aren't familiar with nurse practitioners, how do they work in comparison with a general practitioner?
They work in the same way in terms of the service to the individual. So we prescribe medications, we make diagnosis, we order ultrasounds, MRIs, CTs, refer you to specialties, do comprehensive assessments. So we work within the medical model, but under a nursing philosophy, so very comprehensive care.
You would think that doctors would perhaps welcome extra hands in these types of clinics, but you believe that's not the case.
Well, I would like to believe that would be the case, that we're all in it for the same reason, Anne-Marie, and that's to provide access to patients or improve access to patients. But that's not what I've seen in my experience of starting these clinics. Some physicians can be very offset by the use of nurse practitioners or other providers in our system to prescribe and assess in patients, basically interfering with their market share, unfortunately.
Billing seems to be one of the factors delaying NPs from opening clinics like the 2 that you have. In Ontario, in fact, they cannot bill OHIP, and they have to be under a family doctor in order to do so. So because it is not a fee-for-service funding model like a doctor's office, a nurse practitioner-led clinic will therefore rely on government funding. How does this block NP clinics?
Well, the ones in Ontario are still going because we have an evergreen model with the Ministry of Health and long-term care in that province. However, the one in Alberta that I started was suspended in terms of funding because the government couldn't find another way to fund it. Fee-for-service is not a good model. In fact, the UK and the US and many other countries have moved away from it because a fee-for-service model means that providers get paid to really keep you sick. And in a salary model for all providers, we are encouraged to keep you healthy. Makes sense, right? So if we had more equitable funding for nurse practitioners, a way to keep them employed through a direct reimbursement model or evergreen agreements with the ministries of health in the provinces, then we would eliminate that barrier to practice.
If that were to happen right now, if you could talk to the health ministries and that were to be allowed right now, would that alleviate or eliminate the problem of people not having a first-hand care provider for them and their families?
Well, let me give you an example. So we currently have 447 nurse practitioners in Nova Scotia. I know that Dalhousie University is graduating 40 NPs a year. So they currently have 40 seats a year. And Athabasca University, where I teach, currently has 74 NP students in the program that live in Nova Scotia. So even if we take the next 24 months, 40 plus 40 at Dal, that's 80, 74 that I have in my program, that's 154 NPs that I could inject into the system within the next 24 months if the financial barriers were removed. That could remove the wait list of 130,000 people.
So what would you say to the provincial health ministers, if you could right now, about nurse practitioners and nurse practitioner-led clinics?
I would say, well, I'd start with the premise that unfortunately, currently we're in a crisis. People are dying. And they shouldn't be. Mrs. Snow and Mrs. Halthoff, terrible cases and examples of the inefficiencies in the Nova Scotia health system. Move expeditiously to make this happen. We can. And we've seen change in health systems move very quickly during COVID. We should be doing this now. There's no need to wait.
Tammy O'Rourke, thank you for this.
Thank you, Anne-Marie.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.